Hello, hello, everybody. How are we? Welcome back to the show. Uh, Thank you for patience these last few weeks. We are back at our regularly scheduled time. So glad that you guys can be with us tonight. Mama B, I see you. Roel, Jack, Grandma Mary, what's up? Debbie from Queensland, I hope it's wonderful down there. Good morning to you. Jack, what's up, man? We're going to let some people come in. Happy Tuesday to everybody out there. We're going to get on Instagram. I think we're over there now. I think we're everywhere we need to be. Tom, what's up, my brother? I missed you too, man. I missed you too. It's so good to see you. We're glad to be back. We're going to have a wonderful show tonight. We had a couple questions that came in throughout the week. Thank you to those who sent those in. And we're going to be spending most of the show tonight on live my audio's in and out. It's probably because can you guys hear me okay? Is my audio team in the back? Is my audio okay? Can you hear me? Give me a thumbs up or thumbs down. Cool. All right. Thank you. Thank you. If you guys have questions, go ahead and put them in the comments and let me know if we're kind of being, in and out from a tech standpoint. Courtney, what's up? Great to see you. If you're new to the show, let us know where you're from. We appreciate you being here. A lot of familiar faces. Thank you guys for coming. We're gonna have a great show tonight. Real quick, I don't know if we have the graphic up yet, but I do want to remind everybody it's the one of the actually the biggest week of the year is coming up at Performance Medicine, the week of Black Friday. And we'll have a graphic for that at some point, but just know that those are our deepest discounts of the year. So if you do go to a Performance Medicine, whether that's in the Knoxville area, Tri-Cities area, Virginia, that week's the week. It's November 25th through the 29th. The whole week we're going to be running our deepest discounts, our biggest specials of the year. So make sure to kind of stay tuned to that. We will remind everybody about that throughout the coming days. All right, Sherry, what's going on in the Gulf Coast of Florida? I love it. Great to see you. Let's see, Stan, what's up, man? Great to see you. Yes, coal miner's daughter. Thank you. Smash that like button. Let us know you're here. We appreciate all the love. And if you haven't subscribed to the YouTube channel, be sure to do that. That way you're notified when we go live. We do this every single Tuesday at 7 o'clock. We generally go for about an hour. We answer all your health and wellness questions. I've seen a lot of comments this week, so we're going to make sure we address some of those as well. Around the one was around this episode with John Hawkins from Blackstone Medical Services, talking about the home sleep studies versus a traditional sleep lab. I know there's some questions around, how to talk to your primary care physician about this. So I'll make sure to bring that up to Doc tonight. But if you haven't checked that out, check it out. Getting a good sleep study is not as complicated as it used to be. So I'd encourage everybody to watch that with John. Thank you in advance, John, for doing that with us on the show, on the Common Sense MD. And then over on Dive Into Diet, we had our nutrition coach, Lucas Schmidt, talk about bromelain. For those who don't recognize bromelain is actually in our pain formula, the Dr. Rogers pain formula. So it has a lot to do with inflammation, swelling, etc. So Lucas does such a great job of kind of really detailing what it actually does. So if you're on the pain formula or interested in it, check out this episode on bromelain. It'll help you kind of understand what that supplement can do for you. All right, welcome in, everybody. Welcome in. Ivy and JC with Ivy. Ivy's and JC and Ivy. Great to see you, Ivy. So good to see you. Doug, what's going on, man? Great to see you. It's so good to see you in here. Connie Lynn, hello. Carter, happy Tuesday to you. I know Carter's excited about Black Friday week. It's one of our favorite weeks as a team. We really come together, and we get on the phones. We do all that we need to do. We get coffee. We load up on the coffee. So we're excited about the next couple weeks. Is Doc ready to roll? All right, let's get rocking. Let's get rocking. Let's see here if I can find my. There we go. What's going on, man?
Hello, Ben. How are you?
I am wonderful. I'm going to fix my background just a tad. There we go. Now we're looking good. We're looking sharp. You're looking sharp. You look like you got a nice haircut.
I did get a haircut. I suggest you get one someday.
You're gonna laugh at this, but I did get a haircut.
You did?
I did. I got it cleaned up a little bit, but as you can tell, the length is still there. We just got a little more. We got a little more shape. I'm feeling a little cleaner, but
It looks
it's
a little greasy to me. It looks like you've got some kind of product in there or something. Is it?
you got. I mean, you can't just you can't. You got to be. You got to put stuff in it. You gotta shape it. You gotta teach your hair what to do. And we actually have a couple hair questions, so I'm looking forward to.
When are you gonna do that?
Tomorrow.
I'm kidding. I like your hair.
Thank you.
I'm
Thank you.
jelly. I'm jelly.
Can we give a shout out to Terry? I see Terry's in here. He's probably
Hey,
over
Terry.
in South Carolina, I believe. It's great to see him in here. We've got a great crew tonight. A lot of great questions are coming in. If you're new here, let us know where you're from. We love to kind of get a feel for where everyone is at. We got one pop from the Gulf Coast of Florida, which is super cool.
Do we have our patient, our diabetic from Australia?
We do. We have Debbie in here, who we want to. Yeah, Debbie, will you give us an update? Give us an update with how you're doing. Last 2 weeks ago, I know you had a rough couple weeks. So give us a little bit of an update. Let us know how you're doing. I see you, Lori. Thank you for that question. Edna, hello. I know Edna got PRP a few weeks ago. I'm interested to see how she's doing. I see Stan's question. Thank you for that. Doc, you ready to roll?
Yeah.
All right. Again, welcome into the show. It's a performance medicine show where we answer your health and wellness questions. If you have a question for Dr. Rogers, go ahead and put it in the comments. And here we go. Let's see. This first question came in through email. A hormone question. Please remind me where you like to see testosterone for a menopausal female.
Again, I go more by clinical symptoms and how are you doing than I do by an absolute level. But actually, probably the ideal level, to be honest with you, 80 to 100. Some like to see their levels higher than that. But I mean, I have some women that work out all the time that want their levels around, 180 or even 200. So the normal levels on a lab sheet mean nothing for women on testosterone replacement. But it's all over the board. So I go more by symptoms than I do labs. But if I was to have an ideal number, it'd be 80 to 100 probably.
80 to 100. Also looking at symptoms. I love that you said everybody kind of likes it, in particular spots. So thank you for that answer. Great question around hormones. This is a hair question. I know a lot of people in here are, concerned around hair loss and hair thinning. So hopefully this helps more than just one person. Do you think colostrum could help hair growth? I've tried everything short of a true pharmaceutical, including the Happy Healthy Hair, which is the Dr. Rogers brand, and hair still does not seem to thicken. I have read that colostrum might help. Curious what you think, and also if anyone else on the show has tried this. So if anyone has tried colostrum in the comments, please let us know. Let us know what you think.
I have
Dr.
read
Rogers?
the same thing, but I really haven't gotten a lot of feedback from my own patients. I don't think I have anybody taking it for that reason. There's so many other things you can do, including prescription medicines, which you may need. But I mean, colostrum, which I've used personally for when I had COVID gut, what I call it, really helped me a lot. But I mean, in theory, it might help. I just haven't had enough experience to tell you, yes, go out and get it. But it's not going to hurt you. Definitely, if you're having gut problems and nothing else is helping, go try some colostrum. I recommended it today to a patient. Um, but don't if you're really getting thin, look at the labs and see where your dihydrotestosterone level is, estrogen levels. Remember, hair loves estrogen. It's not real fond of too much testosterone. Um, so that's why you see, all the bodybuilders without any hair, because they've taken way too much testosterone. It turns into dihydrotestosterone, which is responsible for hair loss and prostatic enlargement. So, I wouldn't hesitate to check your levels, see where you're at. And there's a couple things besides happy, healthy hair. And also, you should use a dandruff shampoo a couple times a week. But a couple things that I use for my patients is oral minoxidil, which is same thing as Rogaine, but instead of having to rub it on your head, nobody keeps up with that. You take it orally, very safe, and sometimes a really small dose of finasteride. And again, depending on what your DHT levels are, and you should never give finasteride to a woman of childbearing age because it could be teratogenic. So, but those are two prescription medicines that I use. And always look at thyroid level, look at iron levels, look at gut function. There should be an answer to the problem of thinning hair. I'm not sure if this is a male or female talking, but
I
for
believe
females,
no.
female, that's what I thought. Yeah, it's really not that difficult to get females' hair growing back. So sometimes it is an autoimmune type process. And it takes some time too, because hair grows in cycles. But yeah, so don't hesitate about at least starting some oral minoxidil and getting the levels checked. But you try the colostrum; it's not going to hurt. I don't know if anybody else has any experience in this in the audience, but certainly if you do, speak up.
I'm gonna, if anybody's had experience, I'm kind of got my eyes on the comments right now. I'm gonna put this up from Carter. Personally, do think a mix of colostrum, grass-fed, and Dr. Rogers Happy Healthy Hours help my hair grow and be a little thicker. At least it isn't falling out as much. Thank you, Carter, for that comment. I'm also gonna put this up from Stacy. Where do you get colostrum? Can you help us out with that, Doc?
Yeah, you can get it at any health food store.
Okay. Any brand that you like?
I forget which brand I got. I'm not really particular too much about that. If you get it at a health food store, it's going to be good.
Yeah. And I'm going to put this up. Thank you, Stacy, for this. Minoxidil works. Thank you, Stacy. And it seems Katie, okay, thank you so much for this. And she'll put up a link. So be on the lookout for Katie's comment here, a link on Amazon for colostrum. Thank you guys for that. Anyone, if you've had experience, let us know and we'll make sure to put it up there. Okay, we're going to go to live comments. That does it for the questions that came in through email throughout the week. Thank you guys for doing that. Welcome in, people. If you're just joining us, as the Performance Medicine Show, we answer your health and wellness questions every single Tuesday at 7:00. If you have a question for Doc, go ahead and put in the comments. We're going to get to every single one tonight. If you guys are on Facebook, you just put up this link for Pure Velvet Colostrum Powder. Thank you for this, Katie. All right, let's get rocking and rolling. See if we can find some questions here. Mama B, thank you so much for being patient with us. You put your question in. I would like to try Life Extension Gamma E mixed to aid progesterone absorption. However, I do have a concern with the lowering of blood pressure as I have very little reserve. Any thoughts on this for Mama B's place?
Yeah, I take the Life Extension Gamma E mixed because I also take a little bit of progesterone because I get a little bit of aromatization of testosterone to estradiol. So I take a low dose of progesterone and I take the Gamma mixed with it tocopherols, and I haven't noticed any lowering of the blood pressure. Certainly, you do it at night, so that's the best time to have a low blood pressure, unless you're getting up a lot at night and getting orthostatic. But I certainly think you should try it. I just haven't heard of many people having a problem with that combination, and it's certainly the mixed tocopherols definitely are going to help absorb better on the progesterone. So yeah, try it.
All right, Mama B's place. I'm gonna put this up from her just because this is so sweet. Thank you so much for this kind comment. That means a lot to us.
Oh, thank you. Thank
Man,
you.
that's awesome. I just wanted to make sure you saw that, Doc. Thank you, Mama B's
Thank
place.
you. Thank you so much.
Real quick, Pop, I want to ask you this. This was a comment that came up on YouTube, I believe, around the home sleep studies, and the question was, like, how do I get my primary care physician to prescribe a home sleep study like the Sleep Image Ring? Any advice for those that want this type of sleep study? I'll put
Yeah,
this.
yeah. Just give them the information and take it to your doctor if they're not familiar with it. But I really like the Blackstone ring that they do because it'll pick up central as well as obstructive sleep apnea, and I find it to be very helpful. Most people don't want to go to a sleep lab. The sleep labs are very expensive. They have a months-long wait list, and I don't know. Your doctor should. I mean, it's a no-brainer to me to do it. I don't know why they wouldn't. If they refuse, and get another doctor. We order them
And
all
I
the time.
and I'll put this up. This is from this is Blackstone Medical Services, who John Hawkins is a representative of. He's the one that was on the podcast today. So if you guys want this information, I'll put it up a couple more times for you. If you guys are interested in doing a home sleep study, which was the subject or the topic today on the Common Sense MD. All right, let's keep rolling. If you guys have questions for Dr. Rogers, go ahead and put it in the comments. I'm looking around, see if I can find a couple questions here. Let's see, where am I at? There we go. Thank you, Stan. All right, what would be a maximum dose of the Dr. Rogers Berberine Max? I have type 2 diabetes, and I know with Berberine, Doc, you have a couple different dosing strategies, whether it's for maintenance or weight loss.
Yeah.
For
If you have
Stan here, what do you think?
if you have type 2 diabetes, you need to take 2 a day. There's really no need to take any more than that, I don't think. And take it 30 minutes before two meals of the day. Remember, it's dihydroberberine, so it's about 4 times more potent than just berberine hydrochloride. So take the dihydroberberine, which is the Dr. Rogers berberine. That's what I order. But you shouldn't need more than 2 a day.
And when you say 2, are you saying 2 times a day of 2 capsules or just 2 capsules?
1 capsule twice a day.
Okay. Stan, I hope that helps. Thank you so much for the question over there on Facebook. And I want to remind everybody who's with us, we had a couple join us on Instagram. We are answering questions over there as well. I got my eyes over there. If you have a question for Doc, go ahead and put it in the comments over on Instagram. Okay, let's go to Lori. Thank you, Lori, for being with us. What is your recommendation for Raynaud's?
Raynaud's.
Raynaud's.
Yeah, that's a situation where you have vasospasm of the small arterioles in your hands. So people that have Raynaud's usually have an associated autoimmune disease like lupus or scleroderma, or sometimes they don't even have one that they know about, rheumatoid arthritis. But anyway, it's a very painful cold fingers. And sometimes in cold weather, they turn blue. And my recommendation, which as a matter of fact, I put a patient on that today, is Cialis, tadalafil, the erectile dysfunction drug. Some people use calcium channel blockers. I haven't found them to be real effective. Some people that just want to go totally natural will get L-arginine, L-citrulline, but I really like the tadalafil, Cialis, for that, male or female. One of my nurses really sings its praises. And you don't have to use a lot. I'll start out at a half of a 5 milligram tablet and see how it does. And again, you only have to take it when, cold weather. But look at tadalafil.
All right, Lori, I hope that helps a little bit. Thank you so much for that question. Let's see where we are. I'm going to put this up from Tom, if I can find it, because I want to give a shout out to Katie and Carter. I like the packaging job of the supplements y'all sent. Smile great when I saw the PM logo. We're super proud of that. Tom, thank you for this comment.
Katie and
Tom,
Carter,
yeah.
all the kudos goes to them because they really do a tremendous job and they work hard with the vitamins. And it's been amazing, how our vitamins are popular because they don't have fillers in them.
Yeah.
They have a 2-year shelf life. They're dated. They're domestically sourced. They're exactly what I want put in them. So yeah, I mean, they're just great vitamins. Fortunately, I met these folks at Freedom to Formulate from Oregon, and it's fantastic.
Tom, thank you so much for that. And I know Katie and Carter, they literally they're packaging those themselves. It is very much very personalized, and we're so glad you like it, man. We have a video. We're editing a cool video of kind of behind the scenes what's happening over there at the Dr. Rogers Supplements warehouse. So thank you guys. Thank you, Tom, for the kind comment, man.
Yeah, they've turned my former weightlifting room into a warehouse for vitamins. So
you just weren't lifting weights enough, man. We couldn't justify having those weights over there when they weren't being used.
Well, I went from lifting heavy weights to more push-ups and pull-ups and using bands. As you get older, you don't need to be crushing the weights.
I love it.
That's a
okay.
true story.
Let's see. Oh, Edna got the other knee down Wednesday. Thank you, Edna, for keeping us posted on that. I hope it goes well. She's talking about PRP over there with Jill Henritzi in our Bristol location. Let's go. I saw
amazing injector. You don't even feel it. I don't know if Edna, but she's injected both of mine. I didn't feel a thing. My shoulder as well.
She is amazing. She did Andy's shoulder, and she did Andy's shoulder, I think, 2 or 3 weeks ago, and he said 2 days ago it's the best thing he's ever done, was getting a PRP into his shoulder. Let's go to Stacy's question. Thank you, Stacy. Details about the testosterone pellet. So with Stacy here, I'm assuming this is talking about testosterone pellets in women. Will you talk a little bit about this? I know this is something that makes performance medicine a little unique. What's your thoughts?
Well, we've been doing pellets for years, male and female. And it's really just the most assuredly way to absorb your hormones is through pellets. I mean, it definitely works. You get great levels with them when you test it. And, it avoids having to take any oral testosterone, which you don't want to do, or estrogen. So we put estradiol and testosterone. Sometimes we just use testosterone in a lot of cases if you don't need the estrogen. But yeah, it's a really simple procedure. It takes me about a minute to get them in. Or probably if it's just a testosterone pellet, just one tiny pellet. It's really small, looks less than the size of a Tic Tac. But the procedure is just like right where I will give you an intramuscular shot right in the upper part of the hip. I numb it up with a little lidocaine, wait a few minutes, have a little punch with an 11 blade. It's just such a tiny incision. There's no need for a stitch, just a Steri-Strip. But you slide a trocar into that area, just about 3/4 of an inch long, an inch maybe, and take the middle out of the trocar, put the pellet in, push the trocar back in, take it out, Steri-Strip it. Literally, it's virtually painless. It's not painful at all, and it just allows for a slow, even release of the testosterone, so you don't get the highs and the lows. And definitely, the absorption is better than the creams. The creams are fine, but you may get tired of doing the daily creams, and the pellet lasts in women 4 months, sometimes longer, and men about 6 months. So, yeah, it's a really good thing. Um, People that get pellets just hardly ever go back to the creams. Um, I had a lady the other day. I may have told you this, but I was doing her pellet, and she started talking. And she said, "There's two things that I cannot do without in life. That's my hairdresser and my pellets." So I
Uh,
loved it.
can we get an amen in the comments? Is there any anybody feel the same way as one of our favorite patients over there in the Tri-Cities? I love that. Real quick, Doc, I want to ask this. Um, we get a lot of questions around, pellets and hormone therapy in women with in regards to cancer and people who are breast cancer survivors. Can you give us a little bit of your strategy around that? Because I think that's like the biggest question we get around female hormones.
Yeah, well, these bioidentical hormones do not cause breast cancer. Um, for a woman that's had estrogen positive breast cancer, you don't want to use any form of estrogen. You don't even want to eat soy. But there's a lot of evidence that for a breast cancer survivor who, they need hormones, but they can't get them if they're estrogen progesterone positive, which is most of them. But there's a lot of evidence that putting testosterone pellet really reduces the chance of recurrence of breast cancer. I forget the name of the breast cancer surgeon up north that's virtually all she does. But you can Google her and the whys of why she does it. But certainly, if it has a chance of lessening your risk for a recurrence and making you feel that much better, out of all the hormones, that testosterone is the one that makes you feel the best, without a doubt.
Mm-hmm.
Estrogen you need for your bones and your brain, heart protection. Progesterone you need to counterbalance, to balance out the estrogen levels, and also to help you sleep. I mean, progesterone has about 30 functions. It's definitely anti-cancer, and it relaxes. Well, I think of progesterone as being a woman's Valium. Of course, testosterone is for brain, libido, muscle, burning fat, energy. Women need testosterone. There's no doubt about it. So,
It's a great question, Stacy, and thank you for letting us talk about this. I'm seeing a lot of amens here. Thank you, guys. They'll put this up from Patty. I think this is great. You're not alone. I appreciate that. Thank you, Patty. Okay, I want to go to Instagram real quick. Thank you guys for being with us over here on Instagram. I see Kendra's over here. Lindsay, what's going on? Teresa, now I'm just gonna read this because I can't put it up on the screen over on Instagram. The question over here from Teresa is how to treat high eosinophils caused by allergies. Have tried all the allergy things and also tried the long haul COVID protocol with ivermectin. No one can seem to find a solution. Sorry about that. But I knew there was going to be one word tonight I couldn't do. That was it. What's your thoughts on this?
Yeah,
You need me to repeat it?
No, I got it. Eosinophilia is where, when you do your a CBC, it has a white blood cell count, and then you have different types of white blood cell cell types, and you have your neutrophils, you have your leukocytes, you have your eosinophils, and there's a whole list of them. But anyway, the eosinophils are the ones that kind of part of your immune system in your blood that fights allergies. So, on your CBC, your eosinophil count may be high. There's something called eosinophilic esophagitis that's a really inflammatory condition of your esophagus. It's kind of hard to treat, but it's treatable. But try to find the source of your allergies. We have, very good medicines, of course. I don't know if you've tried all the other ones. Like, obviously you probably want to get on. I treat it similarly to mast cell activation syndrome. I use a lot of Zyrtec. I use a lot of famotidine, the H1 and H2 blockers, histamine blockers. Sometimes I use Singulair, which is leukotriene. I use a lot of different things, but I try to find the source of what's causing you to have that reaction. Sometimes I'll do food sensitivity blood test. Sometimes I'll send people to an allergist to get more detailed scratch tests just to see what they may be exposed to. Sometimes we'll try to do a detox, like a CellCore detox, like Andy did. There's a lot of ways to approach it. Just depends on the symptoms and how bad it is. Sometimes I use quercetin. I use NAC. That immune complex that we have made is a really good one for that. But yeah, it's going to be a difficult problem, but it just depends on what you're coming down with. Are you getting sick a lot? You have chronic allergies. Do you sneeze all the time? Sometimes mold toxicity comes in there. You've been exposed to mold. Heavy metals. Have you had pesticides? So a lot of it comes down to the environmental things that may be causing that. Sometimes I think it's inherited too, the tendency to have that. And of course we see it with long COVID as well. It's like you said.
Teresa, that's such a great question, and I hope that helps a little bit. Doc, thank you for that. We're gonna thank you guys over there on Instagram. If you have questions, I'm looking at y'all as well. So please don't hesitate to ask a question if you have it. Real quick, I just want to put this up. Thank you, team, for getting this ready for us. Black Friday is coming up. This is the one of our favorite weeks of the year. Our biggest specials all year round. People sometimes buy things for the entire year. You can see there's VitaTrim, testosterone shots, there's pellets, all or most of the Dr. Rogers supplements. You see the gummies there. I'm going to put this up kind of throughout the next couple weeks. I want to make sure everybody gets to take advantage of this if they want to. So thank you, team, for getting that ready for us. And if anybody has questions around that, I know Katie's in the comments as well as Carter. We can help out in any way possible tonight. So thank you. Thank you, team. All right, let's keep going here. I see a question from, I see one from Stan. I'm going to get to Stan in just a second. Let's get over to YouTube here with Debbie. So Debbie, of course, updated us a little bit around her EDKA. Questions: I'm still recovering. Can you suggest something to help boost my energy levels that won't affect my BGL? Doc, you might have to tell me what BGL is.
Blood glucose. Blood glucose.
Okay.
Yeah. Of course, I like CoQ10. I like PQQ. I like taurine. That's what we put in that energy formula. And you might even try methylene blue. I really like methylene blue for energy, especially mental energy. It takes a while from an episode of DKA to really get your energy back. You need to definitely hydrate, make sure your electrolytes are fine, because that can really throw that off, that acid-base balance. So make sure you're getting your electrolytes checked through a blood test. I'm sure your sugars are probably back down to normal now. But I like methylene blue. I like CoQ10. I can't see either one of those affecting you in an adverse way. Sometimes, like if you were over here, I would probably do a Myers cocktail on you, which is an IV infusion of vitamins that would really probably help you feel a whole lot better. But make sure you're getting your rest. You will recover. It just takes time. Even if you didn't have DKA, you laid in the hospital for a few days, you feel terrible for 2 weeks. Episode of DKA that really throws metabolically everything off, including your electrolytes, your acid-base status, and you need to keep up with your hydration as well. So I hope that helps you. You
Yeah.
will, you will get better. It takes a while though.
Debbie, thank you so much for the question and giving us a little update here. Just know we're sending you good vibes over here from the States. So please let us know each week how you're doing, how you're recovering, and hopefully that helps a little bit. Thank you, Debbie. Okay, let's go to, I see Velma had a question over on Facebook. I want to get to her if I can find it. Lost it. Let's see, Velma, where are you at? And here we go. All right, thank you guys. Been coughing since April, been to ear, nose, and throat doctor, regular doctor, and gastroenterologist. Nothing has helped. Any thoughts on what to do next? Velma, we hope you feel better. What's your thoughts on this?
Wonder if you had some kind of environmental exposure, like to mold or something. Hopefully you're not on a blood pressure medicine that's called an ACE inhibitor. That can cause a cough in about a third of the people that take it, like lisinopril. Surely you wouldn't be on that by now if you've seen 3 doctors for this. So it doesn't seem to be reflux or any sinus if you rule that out with them. Certainly, hopefully somebody's done a chest x-ray on you just to look and see. And the other thing you might want to do, depending on whether you're desaturating, if you're short of breath, you know, you might have vasospasm, or excuse me, bronchospasm, and an inhaler may help you. You know, the thing that I don't know if you had COVID and you just didn't know it. One of the things we did for COVID was use nebulizers with budesonide, which is a steroid compound that really helps open up your airways. So it'd be really interesting to see what the workup has been. You know, if you had, like we just talked about, eosinophils, had a bunch of eosinophils on your blood count, that would portray something that was allergic in nature. So you got to start thinking, is it environmental? Is it mast cell activation syndrome? So even if you don't have an obvious sinus drainage, you might want to, if the inhalers don't work, or bronchodilator inhalers don't work, Singulair is something I use. I still take an H1 and H2 blocker like Pepcid and Zyrtec, and that should get better. Some people that get bronchitis will cough for months. They just seem to have that tickle cough in the back of their throat. And I think a lot of times it's just a spasm or irritation. But there's got to be an answer somewhere. Sometimes I'll prescribe these things called Tessalon pearls for a dry cough. They seem to work pretty good for dry coughs. Trying to think of any other advice to give you. A lot of it depends on clinical situation. Is it worse when you lay down, which it still could be reflux? You know, is it worse on exertion? It could be exertional asthma. I saw a case of that today. So you may need pulmonary function test by a pulmonologist to see, you know, how much air, you may have some air trapping. I had a guy today actually that had was exposed to a lot of burning brush, and he saw a pulmonologist, had a pulmonary function test, and he could breathe in the air fine, but he couldn't get enough out. So his forced expiratory volume in 1 second was bad, but he wasn't short of breath, but he had just a chronic cough. So if nothing else, if none of that stuff works, see a pulmonologist. We get some films as well.
Velma, thank you so much for that. I hope that
And sometimes
helps
look
a
at
little bit.
your diaphragm too. I mean, sometimes, you know, chronic cough can come from diaphragmatic irritation. You know, sometimes we'll do an inspiratory chest x-ray and an expiratory chest x-ray to make sure that diaphragm is moving. Sometimes it gets paralyzed for unknown reasons. Other times there is a reason, but I've seen people do that from gallstones as well. So it sounds like it maybe need to try a few things and maybe a little further workup than you've had.
All right. Thank you, Doc. Thank you, Velma, for the question. Let's get to Don real quick. I love this question from Don. I know we've talked a lot about mast cell activation syndrome. What are your recommendations for MCAS, mast
Yeah.
cell activation syndrome?
Look, go to the podcast I did on that, and we talk about it at length. But try to find if there's a source of, why your body's releasing so much histamine from these mast cells that are overacting. It's kind of like, that cytokine storm that we saw in COVID, overactivation of your immune system. So it could be genetic too, but try to find a source if it's possible, and maybe an environmental exposure, foods, that type of thing. But I like to use a combination of Zyrtec, Singulair, and Pepcid. Those are all histamine blockers. And sometimes I'll even, throw in quercetin. I really like quercetin for this a lot. And maybe NAC, NAC, which is really a component of Mucomyst that we use for kids at times, which cleared a Tylenol overdose. But try those obvious things that I just mentioned. Sometimes I even have to quail it down with a little bit of short-term steroid use, prednisone. But look at your blood counters, look for triggers, and look for other things. And listen to that podcast. I'll talk in more detail with that.
And Don, what the best thing to do there is either go to performancemedicine.net and then go to our blog, and you can search for MCAS, MCAS, or you can go to YouTube and search Performance Medicine Mast Cell Activation Syndrome or Tom Rogers Mast Cell Activation Syndrome. I hope that helps a little bit. All right, let's keep moving here. I want to put this up from Mark. Thank you, Brother Mark. Great visit with Doc last week. Thanks to Sherry and the Kingsport fam. Huge shout out to Sherry. Sherry, we love you.
We had a great time. We had a great time. Mark always brings us a bunch of good stuff, and you look great, Mark. You really do.
Thank you, Mark. Let's put this from Stan. Great question here around the Cleveland. Just want to make sure is it still okay to come in for the Cleveland test without an appointment?
Yes, for sure.
And real quick for those who don't know, and there is some confusion. Do you need to come in fasting for this? What's your kind of 2 cents?
You don't have to. The kind of the traditional way we do things is fasting for that kind of blood work, because if we look at your lipids, your insulin resistance numbers could be affected by eating. So preferably, fasting, but sometimes I'll prefer a non-fasting lab as long as I know it when I'm going over the results to see if something you ate really popped your insulin level up. But for the most part, it's pretty safe to come in fasting.
All right. Thank you, Stan, for that. I hope that helps. All right, let's keep going. Oh, cool. I want to put this up from Stacy. Got her first pellet today. That's awesome.
Oh, wonderful.
That's awesome. Let us know how you start to feel. For Stacy here, when do they start to kind of feel the difference?
About 5 days. About 5 days.
Yeah. All right, Stacy. Next week we want to see you in here. Let us know how you're doing, how you're feeling. Okay, let's keep going. Let's go to Emily. Emily, what's going on? Emily's one of our estheticians over in Johnson City. Just traveled Vietnam and Cambodia. Wonderful trip to and from, but want to do a parasite cleanse. Do we have a go-to?
What is Emily? Get Andy to do a cell core cleanse. Probably you could do a quicker one on that, since it's not really a chronic thing that you have. But yeah, it's not a bad idea. And talk to Andy about doing a short cell core cleanse.
And for those who want to learn more about cell core, we did a couple different videos. So if you search for cell core performance medicine, should show up over on YouTube. Thank you for that, Emily. Okay, let's keep going. Let me see where I'm at. Where am I at? Gosh, such great questions. Let's go to Doug. Doug, thank you so much. My skin around my nails and cuticles on my hands have recently begun peeling and is splotchy and red. Any ideas on what might cause this? and how to treat it. Thank you, Doug.
I hope you're not picking your nails or biting your nails. If that's the thing, that's the cause. I see that a lot. People that or they're always peeling their nails back. Some kind of mechanical irritation that you're doing. It could also be some kind of lotion that you're sensitive to. It seems like the areas around your nails are very sensitive. Those cuticles are very sensitive. If they're peeling, if you haven't been sick, sometimes it's a sign that you have been sick. I saw that a lot with COVID. Really thin, red, splotchy nails. And the things you could do, again, you might want to get somebody to take a look at it. Sometimes I'll even look at vitamin levels. Sometimes I see that vitamins levels will be off. Electrolytes could be off. Same thing happens in the corner of your mouth. Sometimes they call it cheilitis, and that can be from even a deficiency in zinc. But most likely it's a localized thing that's happened to you, either an exposure to something or I've seen extreme stress do that to people too. I really have, and they may not be aware that they're constantly rubbing on their cuticles. So hopefully you're not biting your nails. That's a really bad idea. Or having a bad habit of working too much on your nails. Gosh, I've seen some nasty infections in women that go to these nail salons sometimes. You gotta be careful with that. But I hope that helps you. You need hydration. I know Kelly has some things in the Johnson City office for that type of problem that seem to be heal it real good. Gosh, I forget the names of the ones she uses. You might even try some oral fish oil, omega-3s, and maybe some natural vitamin E. They seem to help as well. So if you try those things, it's not getting better, have somebody look at them. If you're near us, come in and see us. If not, see a dermatologist.
Thank you, Doug, for that question. I want to get to this from Kelly, and Kathy's got a great question too. I can't wait to get to that. Kelly's question is a good one, and probably one I'm you're seeing quite a bit of. Been taking berberine for about 7 months now. It's starting to make me feel really shaky during the day, even when I only take one capsule. Did the formula change, or can you take a stab at why this might be happening? And Kelly, I'm assuming this is the Berberine Max, the Dr. Rogers brand. What's your thoughts on this?
Yeah, Berberine's potent medicine. I think it's about as potent as metformin for diabetics. So it sounds like to me you were having some insulin resistance, and you're at the point now where you may not need it because you may be getting hypoglycemic. So what I'd like you to do is check your blood sugars. Even continue taking it for a few days while you slap one of those Freestyle Libres on, or the Stella, the new over-the-counter continuous blood glucose monitor. So it sounds like it's maybe changed things around for you for the better, that you may not be so insulin resistant anymore, because it can take a person who isn't and get them a little hypoglycemic, which is what sounds like happening with you. I don't know if you've changed your diet around or anything like that. If you get on that and you're compliant with a low carbohydrate diet, and then you go back to eating sugars, that could happen. So hopefully you're continuing to, if you took it for weight loss, or if you took it for insulin or diabetes, hopefully you're where you need to be and you can stop taking it. But it'd be just interesting to check your blood sugars, because you're getting low blood sugar. That's probably what's doing it, unless you've really changed your diet and gotten off your routine.
That is super interesting.
But
it's
the
like
formula hasn't changed. It's dihydroberberine.
Yeah,
and it's potent. It works.
So for Kelly here, would you say wean off of it because it's worked, or
yeah, I mean, if it's making you feel like that all the time, just stop it.
Yeah,
you don't have to taper off of it. It'd just be interesting to see
Yeah.
with a glucometer if that's what's going on.
That's super
So
cool.
get that and then stop it and get some data and we'll see what happens. Obviously, I'll tell anybody that takes any kind of new medicine, even a supplement, if you don't feel good, stop it and see if that is what was causing it.
Mm,
If you think it's coincidence, take it again for a couple of days and see if the same thing happens to you. There's no doubt that's what caused it.
That's a
So it
great
probably is a
question.
good thing for you.
Kelly, thank you so much for putting that in there. Let's see. Let's get to Mark here. Thank you, Mark. The CDC reported a more than fivefold increase in cases of pertussis in 2024, the virus that causes whooping cough. Any thoughts and suggestions on treatment?
Yeah, gosh, I don't think I've ever treated a case of pertussis, but certainly the reports are it's making kind of a comeback. Um, whether or not that has anything to do with vaccination status or not, I don't know. But it's a hard virus to treat. You got to treat symptomatically. Sometimes with antibiotics that kind of will prevent bacterial infection. And yeah, I still think Z-Paks work for viruses. I really do. But yeah, I mean, that's what we're hearing about, little pertussis. It's I certainly haven't seen it, but when you hear a case of whooping cough in a kid, you kind of instantly know what it is. So we'll just see. So symptomatic treatment, aggressive treatment, sometimes nebulizers, sometimes still use antibiotics to kind of clear up any super bacterial infection you may get with it. But again, I just haven't seen much of this personally. Of course, we're not doing we're not epidemiologists either. So that's who you're kind of trusting to look at this in people through the health department.
Mark, thank you so much for that question. Great question. Let's get to Kathy here. Kathy's got a couple. I want to get to your other one here after this. My PCP put me on semaglutide with a low dose naltrexone and B12 troches for weight loss. I have researched this and can't find much about this combo. What do you think of this? She said it's a cheaper option than the shots. I think so. Is this a combo of semaglutide, LDN?
Yeah, I've heard of there's people using that. It's probably an oral semaglutide instead of a shot. I haven't found the oral to work as well as the shots. There's no doubt about that. Some of the compounders are making it. It's sure worth a try because it is way less expensive. And low dose naltrexone, we have used that for a lot of different reasons, including some weight loss. And B12, that's just for energy. So I'm not against that at all. You're not going to see a lot of that in the mainstream media. That particular combination is just something one of the compounders has come up with to try to make something unique. I'm certainly not against it because I like I like B12, I like low dose naltrexone, and I love semaglutide. The oral stuff doesn't seem to work as well, but give it a shot.
Yeah.
See how that works for you.
And Kathy, keep us posted. Let us know what you think over the coming weeks and months on that. And Kathy's got this wonderful question that I'm actually very curious on too. If a woman can't afford to do one or the other, meaning pellets or the weight loss shots, which is the semaglutide, Ozempic, tirzepatide, which one would you recommend first for health reasons? So it seems, obviously these are two really amazing things and hormone therapy with pellets or, the weight loss, GLP-1s, if you could only do one, which one would you kind of attack first?
That's a hard question to answer without knowing the specifics because, again, if a person's really suffering from obesity and metabolic syndrome, I would say do the weight loss. If that would be my preference. But if you're having terrible menopausal symptoms and it's early in the menopause when the initiation of these hormones are much more useful again, the earlier you start these hormones, the better off you are for long-term longevity and health. Then I would consider that. So in other words, if you're just barely overweight and want to do that, not so much. You can do it through a better diet, maybe some berberine or something, but it's inexpensive. But yeah, I mean, both the semi, if your insurance won't pay for the semaglutide, which they don't a lot of times, it's expensive, and the
Yeah.
pellets aren't cheap either. So a lot of it will depend on the severity of your weight and your metabolic syndrome. So that's a hard one to answer.
Yeah.
You know, you know, but always go with your gut. If you know what the answer is for you, that's the one I would go with.
It's such a good question. And one, Kathy, I can't thank you enough because,
It's a great question. It's a great
yeah,
way to look at things because sometimes
yeah,
there's priorities. Unfortunately, in medicine, this stuff costs a lot.
yeah.
Um, but yeah, but
Well,
it's certainly
and I say that, Kathy, just because I want that to be, a way that people use this show, is, hey, if you can only do one of the two or one of the three, there's more and more options available these days. And just like Doc said, a lot of it is dependent on, you in particular, and hopefully we can help with that. That's really cool. That's a great question. So thank you. I want to get to Velma real quick with this pulmonologist question. What pulmonologist would you recommend for asbestos testing and treatment for a relative?
gosh, I mean, most of the pulmonologists I've met around here are fantastic. There's
Mm.
just not enough of them, to be honest with you.
So the one you can get into?
The one, yeah, the ones you can get into, they're all very well trained in asbestosis, and that's who I would see.
Uh, Velma, I hope that helps a little bit. And I'm going to put this up real quick for Doug over on YouTube. Katie's saying beef tallow as well as kind of a natural solution to the skin around the nails and cuticles.
Yeah, great
peeling.
point. I love beef tallow.
Thank you for that,
I use
Katie.
it.
Let's go. I see Emily's question. I missed this one. Pre-perimenopausal, do we ablate ovary/uterus/gusto? And how does hormone therapy work for these cases? I hope I'm reading that right, Emily. What's your thoughts on this?
I'm not sure what you're really asking. Of course, we don't ablate ovaries and uterus and gusto. I'm not sure what you're talking about there. I probably should know it, but yeah, you always get your levels checked and see where you are. If you're pre-perimenopausal, you probably have a normal cycles, but some women don't because of other conditions. It's just a guess. So if you do the lab work, get an FSH, LH, estradiol, progesterone, testosterone, DHEA, we'll kind of know more where you are. But it's smart to start looking at your hormones as a woman when you're about 40 years old because they drop out at different rates. And the first one to go is usually progesterone. And what that allows it to happen is your estrogen level goes too high because progesterone counterbalances it, brings it down, because if you have too high in estrogen and no progesterone, you can get fibrocystic breast, overstimulation of breast, and also uterine fibroids, thickening of the endometrial lining, that type of stuff.
It's
but-
PCOS. PCOS.
Oh,
Yeah.
PCOS. Okay, okay. Yeah. Again, look at the numbers. Look and see where you're. Again, COVID did a lot of things to women's hormones. It caused a lot of problems with fertility. It caused miscarriages. I mean, it caused all kinds of problems, and threw women into menopause as well. So look at the numbers, and a lot of times I use LDN for that, low dose naltrexone. I like to see where the hormone levels are. Great question.
Emily, yeah, thank you so much for that, Emily. But big thing I'm taking there is, 40s when you start to really see where your baseline is at, and check your hormones early. I love that. Thank you for that, Doc. I'm going to go to Instagram real quick. I see Trained Right K9. What's going on, man? Question is, how effective is grapefruit for high blood pressure?
Some people think it works okay. You got to be careful with grapefruit, especially if you're taking it around other medicines, because it can really either enhance the absorption of a medicine or take away from it. So unless you're really trying to do something very specific, which I've seen people do with grapefruit, they like some people will take rapamycin with it, so that they don't have to take as much rapamycin. They take a third of the dose and they get the levels because it enhances the absorption of rapamycin. But in general, I don't think the grapefruit diet actually worked very well if you look back but it can sure have an effect on absorption of vitamins as well as medications, especially medications. So if I eat grapefruit, I try to take it away from taking anything else. And I don't think you're gonna have that much luck with just eating grapefruits as far as weight loss, unless that's all you're eating, and that's not really a balanced diet.
It's a great question, Trained Right. Thank you so much for that. Real quick, guys, I'm going to put this back up, and I'm going to put it up again next week. Biggest week of the year over at Performance Medicine is happening November 25th through the 29th. These are the specials we are running. These are the biggest specials we run all year long. Like I said earlier, some people take care of their entire year during this week. You can prepay. I think the prepays are good for up to a year. Katie can correct me if I'm wrong, but you can prepay. It'll be good you can use it within the year. So that's until next Black Friday. So thank you, team, for putting this up there for us. And we're going to keep showing it to you the next couple of weeks as we're running these specials. And I see, real quick, guys, how do we do? That's Izzy right there. Oh, yeah. Okay. Thank you, Katie. We are starting to take prepays now. So if you don't want to come in that week, you can just call an office and say, hey, I want to take advantage of the Black Friday specials. You can go ahead and start the prepay process today. Actually, not today because we're not open right now, but we're open at 9 a.m. in the morning. Thank you, Katie, for that. Okay. How did we do? I think we did great. Izzy thinks we did great. What do you guys think? Courtney thinks we did great. Thank you. Thank you, Stan. Man, Pop, what a show tonight, man.
What a great show, man.
And I tell you what, like,
here's Ike. Ike wants to get in.
Ike's ready for it.
Ike, come on. All right.
Ike loves the camera. Ike is not camera shy. He didn't want to
drink of water.
Thank you, Terry. Thank you, Connie Lynn. Man, we're getting a lot of tens. Thank you so much.
That was a great show.
What an amazing night. Thank you so much. We do this every single Tuesday. For those who don't know, Tuesdays we go 7 to 8. We answer all your health and wellness question. It's one of my favorite hours of the week. I get to hang out with my dad and you guys. So thank y'all. Thank you for being with us. Ashley, thank you. Mark, I love this, Mark. He needs a hair exorcism. And that's probably true.
That's a good way to put it, Mark.
I love it.
You see a lot of guys like that in West Virginia, Mark, but they're usually running up in the holler somewhere, doing something illegal, I think, but maybe not.
Guys,
they sing country music.
That's right. Thank you to everyone on our team tonight. You guys are amazing. Thank you to everybody inside the office. Y'all are so amazing. We appreciate you so much. We will be back next week, Tuesday, 7 p.m. Doc, I love you, man.
Amen. Good night.
I love you, Tom. I see you. Tom, thanks so much, man. All right. I'm looking for my outro. Where's it at? Come on, Brad.
Don't go away.